really know what all to talk about, so I guess we'll just chime in once in a while on different topics.
Yeah, in our clinical one, we were kind of given talking points. The first one is what your favorite suture is. I can start with that. I've really only done one pretty consistently, which is the single intradermal or the hidden suture. And it's kind of just my favorite or my most used one because that's the one my preceptor always uses. And like I said, it's really the only one I've put to practice myself. So
Yeah. I guess I have two. The baseball stitch, just because it's easy to do and it's the one I use the most. And also the worm stitch on cranials, just because it's a lot easier than trying to do a baseball stitch sometimes if there's a lot of hair involved. So I just think it's a lot more easier method than trying to baseball stitch a cranial.
Yeah, I also agree with my favorite being the baseball suture. It's honestly the only one I'm the most effective at right now. But I think with more time, I'll get more experiences with other sutures.
The baseball stitch is usually what I use too. It's the most effective for my skill set so far to get that tight seal on the incision. What are you guys' favorite instruments that you use in the prep room and why?
I like the aneurysm needle. I like it because it's not as sharp as the aneurysm hook. So because I'm still a little bit weary when, trying to break up that tissue, it's just nicer to use that one because I'm less afraid of breaking like an artery, not an artery, but like a vein. And also I like actually being able to put the ligature through it, and just it's super easy. I don't have to worry about rolling the vein or the artery or anything like that.
I don't know if I really have a favorite instrument. I just overall enjoy being in the prep room, embalming, and doing that. But I guess probably the thing I like using the most is a tissue separator, just because we do a lot of raising femorals, and it's just people around where I'm from aren't exactly small people. We kind of have a joke. We call them Midwest mediums. And it's a lot easier when you can use a tissue separator and then just you can really see what you're doing.
I like tweezers. I feel like I can make a lot of use out of a tweezer. Pluck a straight nose hair.
Yeah. I was going to ask, what other things do you do with it?
We don't have needle threaders where I'm at, so or the aneurysm with the threader part, so I just stick the ligature in there and grab my tweezers and pull it through. So those are pretty universal tools for me. I like those a lot. It's not the most official tool, but I think I like them.
I'd say my favorite is the needle injector, just for its convenience. I haven't personally had to suture a mouth shut or had to do any of that myself, but I've used the needle injector many times, and seeing my preceptor use the suturing of the mouth, it's a little more difficult, and it's definitely a lot easier just to 8 pumps with the needle injector and then do a little twisty tie off, and it's pretty convenient.
Yeah.
Have any of you, just to go off the needle injector thing, I just had a thought about, have any of you ever seen an old timer with, it's a really primitive kind of needle injector. They take the same little barb and they put it in a tube and they use a hammer instead of anything else. Have you ever seen anyone do that?
No. Oh my gosh.
Yeah, it's apparently a very old school thing they used to do, and I saw it one time and I was just like, I'm glad we have needle injectors.
Yeah. Have you sutured mouths closed?
I have, yes. Only once, though.
Well.
It's not as fun.
It is not.
I think mouths are the thing that bother me the most. They're the most gross to me. So getting really up in there and just sewing it up is not that fun.
No, especially when you're going across the bridge in the nose.
Yep, a really high septum piercing.
Mm-hmm.
I personally don't like whenever you have to go back through where you made the first I don't know what to call it, like the first, not incision, but the
Poke.
the first poke, and having to go right along the bone. It's so hard to like follow that so tightly.
Yeah.
What about we can move on to the next one. What's your guys' preferred pressure or rate of flow?
Oh, we kind of talked about this the last semester too with my podcast group, and I found out that at my funeral home, we embalm at a pretty high pressure. We typically have a potential pressure of 50 psi with an actual of around 40, and then we usually have the rate of flow fixed pretty much wide open is what my preceptor uses this setting of 7 on a porta boy machine. I don't know what machines you guys use, but yeah, talking with other people, apparently that's pretty fast, and everybody else did it relatively slow. So I was just kind of wondering what you guys was like.
We use a porta boy too, and we usually set the potential at 40, and then when we open it up, it goes down to 20. That's kind of our standard. And then usually when we inject into the head, we always turn that down to where the actual pressure is going to be around 15, and we go pretty slow.
Yeah, we're pretty similar. We drop it down to about 10 when we inject upwards when we're doing a right at the right common carotid and that. So.
Mm-hmm.
Mine's hard to tell because our dial doesn't actually read. So my preceptor's just done it forever with that machine, and he just sets it. He says it's around 40, but I don't know the actual number.
For ours closed is about like 20, 25-ish. And then when it's open, it's about 17 to 15. And for the head, it's about 10 to 11. So I guess I'm the oddball out here. Mine's the slower rate.
Yeah.
It was weird because one of the gals I talked to in last semester's podcast, she embalmed everything at like a 10, like the entire body. And it took like 2 or 3 hours to do an embalming, which was kind of bizarre to me. Mm-hmm. But apparently it was very effective. So I mean,
I guess that's just part of if you have the luxury of being able to be that thorough and slow.
Yeah, I think they were like a embalming only type of spot where she was working. They didn't do any of the other funeral services. So.
Oh, well, that makes sense then. Yeah.
More of like a lab. So.
Or what are they called? Like where they just do trade stuff for everyone.
Mm-hmm. What has been some of the most interesting things you guys have seen so far?
There's been a few, and it's hard for me to even narrow it down to one because our coroner does a lot of his autopsy work at our place. Does anyone else do that at their place?
No.
So I've seen a lot of interesting stuff on that side, but as far as embalming goes, nothing too crazy. It's just most of my stories are from the autopsies.
That would be so cool to see.
After a while, it gets kind of old, I'll tell you that.
I bet. Mine do it at the hospital. And right now I work at the hospital as a nurse aide, so I am trying to get in so I can go watch an autopsy. Like, I want to see what happens before I get them.
Mm-hmm. For me, I guess something that was interesting was it was relatively recently. We had this older woman, probably like 60s, 70s, come in. She was already purging out of the mouth. It was like, the coffee ground color. So we're like, oh, well, that's not great. And then when we finally like removed all her clothing, she had like this greenish color from her neck down to her abdomen. And her abdomen was very distended. So obviously like a lot of gas. And whenever we popped open her, I guess popped open is the wrong word. Whenever we made the incision and raised the artery and vein, blood started like coming out, like bubbling out. So we're like, oh, there's like a lot of gas. So we had to immediately do a cavity aspiration on her. And she was just an interesting case because I've never seen it like that obvious in your face before of all these issues. And yeah, that was mine.
One of the cooler things I've seen is we did an autopsy of not an autopsy. We did an autopsy case embalming on a guy that had been through a car accident. And it was really cool when you had everything open and you were embalming everything that you could see the ribs and how much damage had been done and how they were poking out through the cavities and like all the crazy damage that was just done to his internal organs that you could just guess from all the ribs poking through. That was pretty interesting to see.
You guys got a lot more cool stuff going on at your places than mine. I work with my dad's my preceptor, so it's like a family-owned small town type funeral home. So it's not as cool things going on, but kind of my coolest thing I've seen is just really just a basic embalming thing, I guess, where there's this decedent we were embalming, and she was embalming pretty good with good dispersion and everything. And when we went to go up into the head, almost like a buckshot spray of clots came out, which was just really the first time I had seen anything like that, where it was quite a bit of pressure release going the other way, which really cleared out, and that was just kind of something I thought was interesting.
When I guess one of those autopsy embalmings I did, I kind of finally narrowed one down for y'all. I just don't know how graphic we want to get into this because it was a rough one, you know.
Just
it was
kind of clear the air for you. It's kind of hard to talk to anybody else about this type of stuff because you never know how graphic to go with it. So kind of being surrounded by your peers here, I'd say go for it.
Yeah, okay. We see stuff all the time. Come on.
Sure. So it was a autopsy, and then we also tried to embalm afterwards. And the situation was someone wanted to go head on with a semi to commit suicide, and they both ended up dying. The truck driver did too. But what made it a rough one was he fell out of his truck and got ran over by it. And when he got to us and we were done with the autopsy and everything, we're just looking at him like, how do we even embalm him? Because his head was basically gone. You know, it was pretty gross. Just to be simple about it, it was gross. Mm-hmm. And the only real thing that could be embalmed was his right arm, because that was the only thing that was really intact. You know, his chest was caved in, left arm was just kind of hanging on by some tendons. Shins were split open. It was just a nasty one, but also an interesting one from the autopsy side, because you kind of get to see how a medical examiner would work through something like that. You know, you just kind of start looking through all the meat paste and deciphering what tissue is what.
That's a good term for it.
That's what it was.
Yeah. Why go forward and try to embalm? Did the family want to view, or was that just what you guys had done, or?
They wanted him to be embalmed, so who were we to question it?
Yeah.
And I'd say this will lead into another thing I'd like to ask you guys is like weird techniques you've used that are like completely out of the book and things to try to embalm someone. So we had to just think way outside the box to just try to preserve the head. And what we ended up doing while we were trying to embalm the extremities and everything was we took what was left of the head and kind of placed it in like a plastic storage container with cavity fluid and just kind of let it soak there for a while we were doing everything. And then we just ended up having to like put a bag over the head with autopsy powder and some fluid, and just it is what it is.
Yeah.
I mean, at that point, I think that's like the only thing you could have done, because like I don't know what else you could have done to preserve it other than completely soaking it, you know.
Yeah.
We've done that before with like really, really tiny infants where you soak them. which is terrible. It's a horrible
Yeah.
sight. But it is, what else are you supposed to do? They're so tiny.
I think that's kind of the standard, is just soak them, where you try to embalm, but you have to do a heart tap.
On an infant?
Mm-hmm.
I haven't seen any infant, like, actual embalmings. The only thing we had to, I think it was a miscarriage.
Well, when they're that small, yeah.
Yeah,
I'm thinking more of like, I think it was like a 6 to 10 month old.
yeah, I haven't seen any of those.
Mm-hmm. I only saw it once, and even this embalmer wasn't my preceptor, but I was working with him, and he was even scratching his head, kind of thinking like, well, I guess we just have to try a heart tap.
Yeah. Did it work?
It worked, yeah. I was surprised, especially being able to find a heart that small.
Yeah. I guess one of the cool things I've done is I've sewn closed a tracheostomy hole. That was pretty cool. I work in the ICU, so it's kind of weird. Like yesterday, my patient got a tracheostomy, so I got to watch them actually perform it. And then in my career as an apprentice or whatever I am, I'm not actually an apprentice yet, but sewing it shut. So that was cool. And then I've sewn closed a bullet entry and exit hole. That was pretty cool.
I hate to say I've done quite a few of those.
Yeah.
And then that you're just making me think of a bunch of stories. Just every time you guys say something, I think of another one. So another autopsy that we had that's interesting it was a law enforcement shooting, and they were using a new type of ammunition that's like a solid copper round, and when it hits tissue, it's just supposed to tumble and bounce everywhere. And we were part of a case that got submitted to the FBI for data on that.
That's
wow.
pretty.
Where do you live?
Hayes, Kansas.
Wow, you have a lot going on over there.
Well, our medical examiner does almost everything for western Kansas and a little bit in southern Kansas.
Wow.
So we get activity from all over.
Where are the rest of you from?
I'm from Sonoma County, so wine country. So we're not that interesting. But I do work at a trauma 2 center right now. So I see interesting stuff there, but not really as much at my current funeral home.
Are you a nurse or an aide?
No, I'm a medical scribe, so
Oh, okay.
yeah, I just take notes and stuff. I'm kind of just following the doctor around. I'm like their shadow pretty much.
What about you, William? Or
Um,
Noah?
yeah. Williams. Yeah. No, it's okay. I'm from a small town, northern Minnesota, so I'm basically Canadian, but not quite. But yeah, it's here's some of your stories. I'm kind of jealous, but also kind of not jealous of how much exposure you've gotten there, Bryce. But yeah, I definitely, we have a medical examiner in our kind of the biggest town close to us, which is an hour and a half away. So that's kind of probably what your situation is, where they kind of get everything for all the surrounding counties in Minnesota.
Yeah.
I'm in Rapid City, South Dakota, so that's like 2 hours away from Pine Ridge. So we get some pretty hard cases from there too.
Mm-hmm.
Big reservation. It's like the poorest in the country. So there's a lot of violence and horrible things that happen there that sometimes we have to get.
Yeah.
But is there any other topics you guys would like to chit chat about?
I think we're supposed to discuss about, what is it? Oh my gosh, I can't say the word.
I can't pronounce this one either. Corticosteroids?
I'm not sure if I remember exactly what they are.
You're like this type of medicine, I think.
I just know, don't they like make you like retain water worse or something like that?
I think
Rheumatoid arthritis.
So it's like an autoimmune thing.
Huh.
I think I wrote down a definition here. They cause tissue to break down, increase capillary permeability, and fluid retention.
So I guess my answer would be
excessive swelling, poor fluid distribution, and difficulty with firming of the body.
Well,
so would you use something for edema with the swelling and the fluid retention?
I think I would.
Yeah.
Yeah.
And then I think I'd also probably use some stronger fluid and then, manipulate, massage extremities and kind of just hope for the best sometimes. That's kind of how it seems to go.
And I when doing some reading, I saw that the restricted cervical injection can help with the swelling too. Kind of.
Oh yeah.
Areas dealing with that.
Have you seen?
Has everyone done a restricted cervical? Okay, I
not.
haven't either. For some reason, every embalmer I work with just refuses to do it.
I think it's kind of our instructor that just really likes them. When I go to, they always talk about Steve just loves those.
Yeah, I don't know. It seems like I work with 4 of them, and I've never seen a single one of them even mention it.
No.
How about any multi-point or any other techniques that you guys used?
Yeah.
So that kind of another question for you. Do you guys do a lot of autopsy embalmings? No.
Yeah, I've only done
So
one.
I forget.
The examiner for us does all of them themselves. So
okay. So I forget who the instructor was that always says to use the subclavians to do your extremities or your arms, I guess. But instead of trying to raise your carotids, from up by the neck where you normally do, the weird thing I kind of learned to do was just where they take the heart out. If you take a hemostat and just clamp onto that and kind of pull it tight, you can just get them right from where the aorta is.
Wow.
And it's a lot easier than trying to dig around. That's kind of a weird little thing I've picked up on.
That's cool.
Yeah.
I think we covered all our topics, if you guys feel like.
Yeah, I think we did a fantastic job.
Yeah, it was nice to hear from everyone's different experiences, especially I guess because you guys are based in different areas, it really helps paint a picture, like sometimes you get all kinds of crazy stuff. Sometimes you're just more of a smaller area. And it's just so interesting that we're all coming from different backgrounds.
Yes, very cool. I'm excited to meet you guys on campus in the coming week or so. That'll be cool to be around peers, people who get it.
Yeah.
Thank you guys so much for meeting.
No, absolutely.
Thanks for sharing the link to get to this meeting, because I definitely would not have been able to do it myself. So
No problem.
Thank you.
Okay, thank you guys. Have a good rest of your day.
You as well.
Thanks.
Bye.
Bye.